Hey guys, so I want to talk to you a little bit about annual wellness visits. This is so simple and easy, and I know I've had this conversation so many times in practice and in clinical instruction as an adjunct instructor and clinical preceptor. We can't seem to grasp the concepts. So I really want to nail this down and make it irrefutable how easy it is to understand what an annual wellness visit is. So the Affordable Care Act in 2009 basically said that insurers have to offer health care coverage to everyone in the United States, regardless of comorbids, what's wrong with you. It'll cover all pre-existing conditions. It also established the annual wellness visit that is covered 100% by health insurers. So this 100% coverage for this visit is a sports physical annual wellness visit. It requires a provider to do a head-to-toe exam to ask the patient basically about the review of systems. Do you have any headaches? All this stuff. You do your normal head-to-toe exam. All right. When a patient responds to you and says, yeah, as a matter of fact, I have headaches, there is no old carts and treatment plan about that. That is a positive finding or an abnormal finding on your health exam. Just like if you were doing the exam and you found a mole or some type of abnormal lesion or some abnormal retina, some abnormal TM problem if you're in your ear exam, some abnormality in the mouth, you are looking for abnormals, and that is the annual wellness visit. Now, the thing is, the annual wellness visit can be the first visit, it can be the third visit, it can be any visit. So the fact whether the patient is a new patient or an established patient has nothing to do with the annual wellness visit. This is something that seems to be quite confusing for quite a few people, because they start using these Z codes about patient being here, and a Z code is an ICD-10 code, so the diagnosis code. So what exactly are we talking about? We're talking about an annual wellness visit. So an annual wellness visit, this is something that the patient signs a form at the front also, because it is fraud to refill medications in an annual wellness visit, because this is the visit that insurance pays 100% for. It's a preventative visit, right? So everything in this visit is about prevention, all right? So that means we can talk about birth control. We can talk about smoking. We can talk about diet, exercise, and we can talk about weight loss. Okay? So these are all Z codes. If you type these into your EHR, you're going to find that all of these has a Z code. That means it's a preventative education. I can apply this to nearly every single patient that I see. I can tell every patient they shouldn't smoke. I can tell every patient how to use birth control, both guy and girl, right? We can talk about condoms. We can talk about birth control pills. We can talk about birth control options. We can talk about diet with everyone. We can talk about a vegan diet. We can talk about a carnivore diet. We can talk about whatever diet with 100% of people. An infant, a child, a baby. We can talk about the formula we're using. Again, diet and exercise. Again, applies to 100% of patients. Weight loss, 100% of patients. So I'm doing a head-to-toe exam, which is a Z00.00, if it's nothing abnormal. I don't find anything abnormal. They don't say anything abnormal during our ROS. A completely perfect patient that doesn't need to see you for 6 months, and they're just doing labs once a year, healthy patient. Now, the second that something is abnormal, this code changes to Z00.01, abnormal finding. Okay, now this is specific with charting. I'm not talking about billing and coding right now. I'm talking about charting an annual wellness visit. Because a lot of times a student will come to me or a provider comes to me and like, hey, I just saw this patient, they're establishing care, and I got these Z codes, you know, I did the evaluation, and then we talked about some stuff. And I'm like, so wait a second, are you talking about you had an annual wellness visit, or are you talking about you had a problem visit? And then there's like, yeah, but it was a new patient. I'm like, okay, but what's a new patient have to do with the annual wellness visit? Nothing. Remember, don't mix this up, because a new patient can be an annual wellness visit and have zero cost to patient, or a new patient can be a problem-based visit. Just know that this is the only thing allowed on the chart if it is a wellness visit. I can only have Z codes. Now, if this person that I'm interviewing comes down here and says, oh yes, I need a refill of my hypertension medication, lisinopril, if I can spell here, guess what? I can't do it, because hypertension is a problem with an ICD-10 code of I-10. So can I put I-10 on this chart with the rest of these Z codes? Oh, I forgot one here. You can talk about vaccines too. Vaccines are Z23. So again, you can use Z codes in an annual wellness visit. You cannot put a problem on the chart. Now, an abnormal finding, first visit, patient says, I want my free annual wellness visit to establish care. Perfect. I don't care, but I'm not breaking the law. I'm not going to prescribe you anything during an annual wellness visit. So if I do find something, so on our annual wellness visit, as establishing care, what if the patient's blood pressure is this? I'm going to chart Z00.01, abnormal finding, because they had an abnormal blood pressure. And this can be double checked during the follow-up, but we're not going to give them any medical advice regarding their blood pressure. We can give them diet. I can talk about low sodium diet. Can I? Because can you talk to 100% of patients about low sodium? I mean, one could argue that that's pretty healthy, right? We don't want a lot of salt in our diet, so I think that argument could be made, but we definitely do not want to provide personalized medical advice during an annual wellness visit. So I'm not going to go into how you should be taking something or doing something to specifically lower your blood pressure, because that's medical advice and that is treatment. And treatment is not covered by insurance without a deductible and copay. Only a once a year prevention visit that has Z codes is once a year. So please remember this. It doesn't matter if it's their first visit establishing care. It doesn't matter if it's their fifth visit. An annual wellness visit can be done at any time during the year, and it must be done once a year with all insurances, because it is a quality gap. It is a HEDIS item for those Medicare people that know what I'm talking about. So you have to do this once a year with all of your patients. I'm harping on it all the time at my practice, because my practice does their annual wellness visits about 30% of the time. That's how quality effective we are at getting this done. Because a patient comes in for their annual wellness visit and then they say, oh, I also need refills. I also need this. And then you have to do the whole old carts, right? Because when you're managing a medication, you're asking, when did you start taking that? How has your blood pressure been? What's your blood pressure logs been, right? Has there been any dizziness when you go to get up? Anything that you have a medication that you're managing, you're going to ask the old carts and you're going to go over the full explanation, and that's why it's no longer an annual wellness visit, because you cannot do that during an annual wellness visit. So it needs to be very clear. This is strictly speaking charting and the visit. It's either an annual wellness visit or it's not. There is no gray area. If you start talking about anything besides these Z codes, you're going to cost the patient money. So if you go and look at reviews of some medical offices, you'll see how patients said, I went there for my annual wellness visit and was charged a fee. Because we're not clearly outlining the guidelines and expectations with our patients and what we're going to do during the visit and how that will affect them. Remember, healthcare is a business whether you like it or not, and you work for the insurance companies. So you better figure out what all their requirements are and how you can keep your patients happy and not delay patient care, and make sure that they're not getting any bills for stuff that you told them they weren't going to be billed for. To do that, you're going to have to learn insurance. You're going to have to learn guidelines. You're going to have to learn billing and coding. It's a requirement if you're going to work as a provider in healthcare. So remember, healthcare is a business whether you like it or not. Understand annual wellness visits. It is such a huge priority. It is the biggest pain in my rear because providers will always chart problems and try to refill meds during these annual wellness visits, and you cannot do it. So that is completely separate from the billing and coding of that visit. So if we wanted to talk about the billing and coding part, this has nothing to do with charting. So again, separate issues. All right, separate issues. So you're going to decide in the billing section, you're going to decide down the line, you have 4 quadrants. All right, on this side, you have a new patient. On this side, you have an established patient. Okay, so that's your first goal and objective when you get to the billing sheet, the CMS 1500, or in your EHR, the claims and billing tab. Was this a new patient or was this an established patient? Okay, so new patient, established patient. Second question, was this an annual wellness visit or was this a problem visit? Did I just talk Z codes or did I provide them medical advice or refill any medications? Okay, if annual wellness visit, this will be box 1 for annual wellness visit. This will be box 2 for annual wellness visit. New patient, annual wellness. New established patient, annual wellness. If you talked about other codes besides the Z codes, or you refilled other medications, you provided detailed, individualized medical advice and treatment, now we're blocking down to problem visits. So this is problem and this is problem. Okay? So question 1, new patient, established patient. Question 2, annual wellness visit or problem visit. Okay? Super simple. If it's a new patient, annual wellness visit, the annual wellness visits are the second to last digit is an 8. So this is going to be 9938, 9938, 9938, and these are based on the age of the patient, the next digit. So you're going to have like 84, 85, 86, 87, based on the age of the patient. So that digit changes. If they're established, now it's 993949596. So that second to last is either a 9 or an 8. That's the determining factor in the billing of that visit. Now, this doesn't apply to Medicare, straight Medicare, red, white, and blue card. That is going to have a few different codes, and it's going to start with a G0, and there's one that's like a new welcome to Medicare. It's the first Medicare visit of their life, and it's only available that one time. So providers, you don't want to miss it, because it is a good paying code. I think it's GO402, if I'm not mistaken. You could double check me, but there's a new patient, new welcome to Medicare. And that is in addition to then that annual wellness visit that would come next. So you can capture 2 new codes during those visits. You don't want to miss those because they're very high paying. The second problem, new patient, established patient. If it's a new patient, you're going to go 9920, and then you have 3, 4, or 5. And this is based on the medical decision making or medical complexity. A lot of times you're going to hear this referred to as MDM, though, medical decision making. So how many problems were in the old carts in the HPI, how many problems are in the ROS, how many problems are in the plan of care, and how many physical components are in that. So a normal physical exam is going to have like 4 components. Right, you're going to have neuro, you're going to have the heart and lungs, and you're going to have musculoskeletal. So there's things that you're going to see on every visit. If you start adding to that, you're going to up your medical decision making for that visit. So again, the second to last digit is going to be a 0 for a new patient with a problem. If it's an established patient with a problem, that digit changes to a 1. 99213, 99214, 99215. So again, 1. So billing is super simple. Annual wellness visits are super simple. There should never be any question whether you had an annual wellness visit or a problem visit. You should be aligned with your patients. You should be aligned with the understanding of what insurance is expecting you to do according to their guidelines. And this is once a year for every single patient that you see. I try to get all mine out of the way January 1, get them all out of the way, that way it's done. On Medicare, you can claim the annual wellness visit anytime January 1 till the end of the year. With commercial plans, it usually runs within their plan year. So when the patient started insurance, if they started August 1st, you can bill that code once during that 365-day year. So you won't be able to restart on January 1. So it's a little tricky to get everybody in line, but this is part of your patient management, part of what you should do in the expectations. So remember, 3 questions: new patient, established patient, annual wellness visit, or problem visit. And then the third question is either age or medical decision making of the problem. Super simple, all right? So keep it simple, and remember, healthcare is a business, whether you like it or not. So please understand what you should be doing during those visits, because we want the best care possible for our patients, and we're not going to get it if we don't understand the requirement of insurances. Till next time.